So thank you to Wireless Mike for this suggestion. This is Phil DeFranco, and he's breaking down the healthcare denial scam. Now, as somebody who was formerly an employee of the local news industry, I know a whole lot about cheap healthcare. So I'm going to be curious myself to see this. Let's dive right into it. Let's see what's going on with Phil DeFranco these days.
Imagine having your insurance claim denied in just 1.2 seconds. Your life, your future,
Oof.
decided in an instant. Well, welcome to Cigna's world, where an algorithm decides the fate of hundreds of thousands of claims, putting profits over people. And here's the thing, we already know insurance companies fuck us hard. But I promise you that by the end of this story, you're gonna want some healthcare to remove your foot from someone's ass. Right? And that's because ProPublica and the Capitol Forum investigated how one of the nation's largest insurers, Cigna, decides whether to approve or deny policy claims. Typically, the way that it's supposed to work is that claims go into the insurance system.
Hold up. Another one. Another one from ProPublica. They've been featured, what is this, 3 times this week? That's some impressive reporting. ProPublica. Well done.
Get screened by a nurse and then reviewed by a medical director. And that's because many state laws require doctors to review each individual claim before insurers reject them on medical grounds, which means examining patient records, going over coverage policies, and generally using their professional judgment. It's meant to be thorough and fair. And for small, low-cost claims, the company usually just pays them out because it's just not worth the time and money it takes to review them. But what if you didn't review the claims and just denied them anyway? Well, reportedly, that's exactly what Cigna's been doing for over a decade now, using an algorithm that automatically denies claims with a mismatch between the diagnosis and tests or treatments for the diagnosis that the company considers acceptable. Then the company's medical directors just sign off on all the denials in one big batch, deeming them all medically unnecessary, with one former doctor saying, "We literally click and submit. It takes all of 10 seconds to do 50 at a time." So in just 2 months last year, Cigna doctors rejected over 300,000 claims using this system and spending an average of just 1.2 seconds on each case. And this has squeezed fat stacks out of the company's policyholders, with Dr. Alan Mooney, the guy who created the system for Cigna, saying it undoubtedly saved the firm billions of dollars. And
Just in case you were wondering what their priorities are. That practice, apparently, the takeaway they have from it, saved the company billions. Great. That says so much about the American healthcare system. Number one, a company can exist while saving billions of dollars. What does that tell you about how much it's taking in? Could they have existed without doing that? There's no good answer. Either, yes, they could have, in which case, Jesus God, how much are we paying for an unnecessary part of the system? The health insurers don't do anything to make you healthier. Not a thing. They don't heal you. So they're existing in a system where an administrative change can save them billions. That's an inefficient system. Or they needed to do this to survive, in which case the only way they can survive is just by blanket denying claims. Other countries, and hey, link in the description, share this with people that need to hear it. Other countries, including people of Canada, America's fancy hat, they don't put up with this nonsense. And if the American voters would get together on this and pressure their representatives, regardless of what party they have subscribed to, pressure their representatives to give us free healthcare, we could just have free healthcare. And by the way, it's been measured to death by this point. We have near peers to compare ourselves to. Just about any other way to do this would be less expensive and more effective. Let me run that by you again. Almost any other country's healthcare system, if we're talking about near peers, almost any other country has better outcomes for less money. Both of those things are true. We did a whole damn stream about this. But in the top 11 countries in terms of wealth measured, the United States came in number 11. And the reason it was 11 and not 10 was just so we could include the United States on that map. Let's let Phil DeFranco take her home.
Former executive saying, put yourself in the
I'll
shoes
keep
of the
going.
insurer. Why not just deny them all and see which ones come back on appeal? From a cost perspective, it makes sense. And adding, insurers are very good at knowing when they can deny a claim, and patients will grumble, but will still write a check, which it turns out is very true. In one document, Cigna estimated that only 5% of people actually appeal a denial from the algorithm. And while that may sound low, and it is low, it's still relatively high for the industry. With one study finding that patients under the Affordable Care Act appeal less than 0.2% of the time, and insurers uphold about 60% of those denials. And then for those who do appeal, it's a fucking nightmare, as one guy who was insured under Cigna found out, telling reporters he was experiencing pain in his bones, so his doctor used a blood test to determine he was vitamin D deficient, with that costing $350. But when Cigna mailed him a letter refusing to cover it on grounds that it wasn't medically necessary, he couldn't believe it, saying this was a clinical decision being second-guessed by someone with no knowledge of me. So being a physician himself, he appeals the denial, and a second Cigna doctor reviewed the case but stood by the initial rejection, explaining that because the patient had not been previously diagnosed with a vitamin D deficiency, the test was unnecessary, which raises
Again, to what I was saying earlier. I see that I'm a little quiet. I'll turn that up, huh? To what I was saying earlier. These people in the health insurance industry are not in the business of providing care. They're in the business of taking money from healthy people and expanding their profit by denying needed funds to sick people. In the United States of America, when you get a serious diagnosis, unlike almost every other country in the world that has the kind of money we have, unlike those countries, you're hit with two emotionally devastating realities. Number one, you have the diagnosis. That in and of itself is the kind of thing people need therapy to deal with a lot of the time. You also have bankruptcy. And at a minimum, you're being assigned a long, arduous dispute with a gigantic company. Does anybody really take the American healthcare system seriously? Does anybody really think that we don't have to change this? Come on. It's been measured already. We already know it's cheaper to have universal health care. It's cheaper. We already know it's more effective. We know the health outcomes are better. Unless you are a Saudi prince, wait times are generally shorter. The health outcomes are always, look at me, always better. And because we are not supporting multi-billion-dollar industries full of con artists, it's cheaper. I don't want to pay for that guy's effing Porsche. He's done nothing of value. Unless that's the guy who was the doctor that had the thing wrong with him. But the point is, I don't want to pay for the health insurance executive's Porsche, because that guy doesn't do anything for society.
This is the obvious fucking question. How is he supposed to have a diagnosis before he got tested for the thing that he needed the diagnosis of? And so at that point, he's just baffled, and he takes us to an independent reviewer who, shocker, after looking at the case, said, hey, the test was in fact necessary. But this entire hassle took over 7 months over just a few $100s, and it may not have actually worked out in his favor at all if the patient himself wasn't a doctor. Now, in response to all this, Cigna argues that the system actually helps patients since it enables the company to fast-track payments for approved claims. One former executive
Yeah, I'm sure that's what they argued.
Said that doesn't actually make sense, saying they were paying all these claims before, then they weren't. You're talking about a system built to deny claims. Plus, the list of treatments and tests that aren't covered for different diagnoses can be somewhat arbitrary. Right, in 2014, Cigna made a presentation weighing the pros and cons of adding another procedure to the list: autonomic nervous system testing. It can help tell if a patient suffers from nerve damage caused by diabetes or a variety of autoimmune diseases, and it only costs a few $100s, which Cigna has been paying out for every single claim without question.
Look, he talks fast, so I'm just throwing these in here when I hear him. What's not being addressed right now is just take a few steps back from the woods from the trees for a second and have a look at the forest. How often do you insist upon treatment when you go to the doctor? How often are you like, no, doctor, tell you what we're going to do. I want you to run a full diagnostic test. You give me a CAT scan. I stubbed my toe. Give me a CAT scan. Open me up, see what's inside in the guts area. Really get in there, and then we'll bill the insurance company. That's nonsense. You go to your doctor, you tell them what the symptoms are. The doctor does tests that they deem necessary. And then, theoretically, your health insurance is supposed to pay for it. This blanket denial just assumes that a bunch of medically unnecessary things were done. Well, who's at fault there? Is it the patient? Nope. That would be, if there was fault, the doctor. But this is an insurance company daring to disagree with the doctor that spent, an hour with a patient? Talking to them about what's wrong? And they're just blanket denying, huh? This is a scam. It's a scam. Pure and simple. A way to know if we should nationalize something, a service, for example, is if every single person in the country has a reasonable expectation of needing it eventually. That is why it is the government's job, by and large, to take care of our roads, because we know we need pathways between places. And so we agree we will all contribute a little bit, and we will get the most efficient use of our dollars that way. We won't pay an executive. We won't pay a third party an infinite amount of money and give them control over our lives and our fates. We go to the government. Same thing with our military. Same thing with police. Same thing with firefighters. Doctors should be no different. This really is not a left or right issue. This is a dollars and cents issue. And if you firmly believe that U.S. healthcare is well set up, you're listening to people who are paid for by the health insurance industry. They're bought, plain and simple. Because the information exists, folks. Top 11 countries, top 11 richest countries, USA healthcare, number 11. Coming in last by a healthy margin. I'm going to let Phil DeFranco go for a while now.
By adding the procedure to the list, it would deny almost 18,000 claims and save about $2.5 million per year, according to estimates. So sure enough, those greedy fucks threw it on the list. But also understand, this is a problem that goes way beyond just Cigna. Right? Health insurers deny millions of claims every year, be it for surgeries, visits to the ER, or life-saving treatments and prescriptions. Meanwhile, the 6 largest private health insurers in 2021 raked in more than $40 billion in profits. And insurance executives say systems akin to the algorithm used by Cigna have existed throughout the industry, with Mooney saying his group made a similar one for United Health so it could deny claims in bulk. And claim denials have become an even more pronounced issue for many people since the pandemic began. Because right now you have up to 4 million full-time workers out of the labor force due to long COVID. And for some, the care that they need to manage their chronic symptoms has forced them into medical debt. Often because their claims are denied by insurance companies who are wary of paying for treatments that they don't know will work for an illness that's still poorly understood. And a paper last year actually estimated that long COVID could cost an individual $9,000 on average per year. But these types of denials aren't the only way that companies are squeezing you dry. With the New York Times investigation last year finding that major health insurers boost their profits by billions of dollars with the oldest trick in the fucking book: fraud. And at the center of this scheme is the Medicare Advantage program, a private sector alternative to traditional Medicare where the federal government pays insurers for each patient who enrolls, with higher payments for sicker patients. Right? As of that time, it was on track to enroll more than half of all Medicare beneficiaries this year. So the companies devised every method they could imagine to make patients appear as sick as humanly possible on paper without providing any more actual treatment. This includes Kaiser gifting bottles of champagne or cash bonuses to doctors who found enough diagnoses and patient records. Or it could look like Anthem, now called Elevance Health, paying more to doctors who said that their patients were sicker. Or how about United Health, the country's largest insurer, telling its workers to mine old medical records for more illnesses, and when they couldn't find enough, just sending them back to try again. With shit like this, inflating the bills for 8 of the 10 biggest insurers in the program. Plus 4 of the 5 biggest to face federal lawsuits for fraud. So basically, Medicare Advantage was initially meant to reduce healthcare costs by privatizing the system, and instead, prices just shot past those of the government program that it displaced. Right? Instead of competing to provide the best care, insurers are competing to see who can better game the system. And the cost to the taxpayers is massive, with the additional diagnoses leading to $12 billion in overpayments in 2020 alone, according to one estimate. Or we're talking about an amount of money that's enough to...
Those inefficiencies are part of, not all of, but part of why this will be cheaper to just get rid of altogether. It is a early 1900s system we are using in the 21st century.
Cover hearing
Time
and
to
vision care for
progress.
every American over 65. But ultimately, I think where I'm going to end this story, two notes. One, the more we talk in detail about stories like this, the more I think maybe Tyler Durden had some good ideas. And two, if you or someone you know is one of the unlucky people who are getting letters denying them coverage, please appeal that bullshit. They are counting on you not. And in the meantime, if some fucking smart people can do something with all the emerging AI to make it just as easy for the people that are getting fucked by these companies to fight back with their appeals and making it easy for more and more people to do so, that would be amazing, because these rich, greedy fucks have just for so long been fucking around, and they deserve to find out. And then, have you ever looked at your outfit and thought, this ain't gonna cut it? Well, there's no better way to
Oh, that was so smooth. He got that in there real smooth. Good Lord. So, ooh. Wireless Mike says the second half of the video is also about healthcare issues if you want to cover it. Yeah. Yeah, I do. Sorry, I'm just looking at the chat there. Yeah, I absolutely do. Good work, Wicked Foxy Dragon. Thank you. I don't have to do the moderating now. I do want to talk about just the health insurance for a second, though, because boy, oh boy, that's the core issue. That industry should not exist. There should be no American health insurance industry. It's got to go. And everybody who's worried about the jobs those people would have, imagine for a moment that there was somebody employed to smash in your window every time you leave the house, and climb into your living room and cut up your couch with a box cutter. Just slice up all the cushions and then run away. And there's people, millions of people around the country employed to do that. Would we not get rid of that as a job? Would the argument that, wait a minute, if you make it illegal to smash in windows and cut up couches, so many couch cutters are going to lose their jobs. Well, it does more harm than good to keep those jobs. A health insurance company, and every single person that works in it is the couch cutter. We have to get rid of them. It's that simple. Vote in primaries. Go as far left as you can. This is one we're going to have to fight even the Democrats on. We're going to have to fight them. We're going to have to make it crystal clear. If you're Republican, guess what? You are not a slave to the party line. Contact your representative. Tell them, I want Medicare for all. Y'all did a great job of changing the tune of the Republican Party on Social Security. Do it again. Do it for health care. Give it to everybody. It is literally just Medicare for all that we're talking about. If you like it for people that are 65 plus, why the heck wouldn't you like it for everybody else? Give it some thought. I think it could be of use. Links in the description, of course.